there was a really interesting study that was done actually using epidural steroid injections in people with neck pain. And there's controversy over doing epidural steroid injections in the neck because the neck is a smaller space than the low back. And so the practitioner just has to be better trained. They can help significantly and actually help the surgeon, determine if surgery is indicated or not. But the efficacy is not so high as it is for the low back of benefit, and the risks are high. So if something does happen in the neck, it can go up to your brain quicker, and also it can, obviously if something happens in the neck, now you might be paralyzed, let's say from the neck down, and not, if something happens in the low back, there's more space. And, if you get paralyzed in the legs, it's very different than if you get paralyzed in the arms and legs as well. And so there's added risk to it. And what they looked at was that if you get a cervical epidural steroid injection, now this is injecting steroid at the site of where your nerve would be impinged, for instance, to try to decrease inflammation. They decreased the pain about 60%, or it worked about 60% of the time. And they're like, we have a very good procedure here. We're injecting steroid at the site. Why does it only work 60% of the time? And so they looked at a whole bunch of different things that why it would actually affect people differently. And, so they looked at things like common things that you might think of, for instance, or that we think of sort of, does smoking cigarettes affect epidural steroid injection? That could be a good question, right? So they looked at cigarette consumption or smoking or tobacco use or anything like that, and that had no association. They couldn't differentiate any group that didn't react to epidural steroid injections. They looked at medication usage, right? They looked at past medical history. They looked at all these different things. And what they found was that there was a group of people, like when they got cervical epidural steroid injection, they didn't respond as well. And this group of people, it was such a big study that they actually recommended changing the way that the epidural steroid injections were offered to people. But this group of people who did not respond well to epidural steroid injections in the neck had untreated depression, which is really interesting, right? You're taking a steroid, you're injecting it into the site where there should be a lot of inflammation, and yet it's not decreasing pain in people with untreated depression. And they thought that it was such a big study that they recommended scanning for depression and treating depression before you had the epidural steroid injection, because maybe if you actually treated the depression, you wouldn't actually need the epidural steroid injection. So it was a fairly large study, which goes to the point of, if there is worry, concern, mood, we are processing. We talked a little bit about where the brain processes mood, anxiety, depression, things like that, where it processes pain. Our mood and our pain are processed in the same place in the brain. And so if we're not looking at these things holistically, we're not looking at mood, at anxiety, at depression, et cetera, as along with chronic pain, we're really not doing chronic pain a service. So, not to see these things as separated, as like, oh wow, these might be imbalances in the nervous system. They might be imbalances in inflammation, which comes from imbalances in our ability to decrease stress, whatever it might be. And so therefore we need to kind of look at this holistically, which is why we have this program to try to bring these tools and techniques to people without having to get insurance authorization, et cetera, et cetera. Okay, so with that, we'll go into our practice. I don't have my bowl. Ding. Um, we'll go into our practice, and we'll just, I'm really inspired by Susie's story, and if you've been with us and you practice mindfulness, that might be just your practice is a number of different tools and techniques come on for you. If you have not practiced mindfulness and you're new to it, it's really about trying different ways of practicing mindfulness with the breath, focusing on the breath. It's about finding something that you feel comfortable focusing on, that as your mind wanders, you come back to what you choose to focus on. We call that your anchor. And so if you're new, using this practice to find your anchor, if you've been with us for a while, see where or how your anchor may change in the same practice, but yet you're still practicing mindfulness, which is paying attention on purpose to the present moment without judgment. So with that, let's go into our practice. I will not ding. Okay, so let's find a comfortable position. A position you feel relaxed yet alert. And for this practice, you can be standing, walking, sitting, lying down. Really any practice that is comforting for you. Closing your eyes if you can close your eyes. If not, having a soft downward gaze as if you're looking off onto the horizon. And just taking an inventory right now of your present moment. What is your experience in this moment? What comes up for you? Emotions, thoughts, sensations in the body, and just sort of noting that. What is your experience? And just noting that and seeing what comes up now, and actively, consciously directing your attention to your anchor, directing your attention to a place that you can focus your attention on that is safer, that feels comforting. Again, this can be your breath. It can be the sensation of your breath coming and going in your body. It can be you counting your breaths in and out. It could be saying in breath when you breathe in and out breath when you breathe out. It could be an emotion that arises. It could be a repetition of a word or phrase that is authentic to you. It could be the sensation, a present moment sensation in your body, or the sensation of your feet making contact with the floor, or your arms resting on your lap. Whatever it is for you that you can direct your attention to that feels safer. And as your mind wanders, as your mind starts planning your lunch or your next meeting or event or whatever it might be, that you bring it back to your anchor. This is a great resource As you come back to it over and over again, you're training your mind, body, and heart to be in the present moment. And similar to the story that Susie told, do you find that your anchor stays the same? If you've been with us for a while, can you use multiple anchors? Can you use your breath in the repetition of a word or prayer or phrase? Can you use your breath and imagine a place that feels comforting for you? And being super detailed about it. And as your breath or as your mind wanders, come back to a place you choose to place your attention. Where do you choose to place your attention? Your mind will come in. It'll try grabbing your attention, bringing it to different places. That can be okay if that's what you choose. If that's what you are aware of in the present moment. Oftentimes our mind may wander and we may not notice that it wanders until we notice that we have not been paying attention to our anchor. And as soon as we do that, with kindness and compassion for ourselves, we simply redirect our attention to our anchor, to our resource, to what we choose to pay attention to. And try focusing on your breath and repeating a phrase or word or prayer to yourself as you're focusing on your breath. Thich Nhat Hanh may say, as you're focusing on your breath, breathing in, I know I am breathing in. Breathing out, I know I am breathing out. Breathing in, I know I am breathing in. Breathing out, I know I am breathing out. As you are breathing in and breathing out, repeating a word or phrase that works for you. And you also imagine yourself being in the most peaceful place you could possibly imagine. being detailed about what you're wearing, who you're with, where you are. As you breathe in and breathe out. Fully experiencing the present moment, consciously directing your attention to where you would like your attention to be. And as your mind wanders, this is exactly what the mind does, noticing that and redirecting it back to your anchor, back to your resource. And just noticing where your mind is now, coming back to your anchor. And taking 2 or 3 deep breaths. Just taking an inventory again of your present moment experience. How has it changed from when you began? If it has at all. Are you aware of your present moment experience? Can you be with it just as it is, with no resistance? Just as it is, with no resistance. And seeing how you can integrate this meditation practice into your daily life by breathing, being present, repeating a word or phrase to yourself. And now, opening your eyes if your eyes were closed, reorienting yourself to your room and your surroundings, and just taking a moment to reflect on your practice. All right, with that, I send you all love and health. That is my wish for all of you. Love and health, love and health, love and health, love and health. That is my mantra, even as I'm falling asleep at night. Love and health, love and health, love and health, love and health. that's the repetition for my kids, for my family, for all of you. May you be well. May you be happy. May you be free from suffering. Many blessings to all of you.